Hi, my name is Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'm going to talk to you about the risks and potential complications of an arthroscopic rotator cuff repair. So what we're talking about is repairing the rotator cuff tendon in the shoulder. This is a typical one, a tear of the supraspinatus tendon. This is an MRI scan. If you see here the humerus coming up, the ball, the socket, the shoulder blades there, that's your clavicle, AC joint is there, the acromion is about there, skin, that's your deltoid muscle. This is the supraspinatus muscle on the top of the shoulder. It forms tendon. That tendon comes across the top of the shoulder, across the top of the cartilage there, and joins that ledger bone. And here, the white there is fluid. That there is deltoid. This is the humerus. The white is fluid. That is tendon, and that is where it should be attached onto. So that is a tear just there. And you can see post-operatively, anchors in the bone, and the tendon is attached down to the bone, and there's no gap of fluid sitting there. The tendon's continuous, which is what we want to see. This is just an example of, this is the intraoperative pictures. So this is the humerus. You can see the cartilage on the humerus there. You can see the cartilage on the glenoid, and that is the edge of the tendon. That needs to go down onto the bone there. This little end fix anchor, we use that to improve the healing of the tendon to the bone. It encourages the tendon to form an enthesis between the tendon and the bone rather than just healing with scar tissue. And that is a completed repair, so we can no longer look into the shoulder like we can here. That tendon is down. You can see that there, and the sutures across the top, and that gives us this picture here. So that's a rotator cuff, and that's an arthroscopic rotator cuff repair. When I talk to patients about an arthroscopic rotator cuff repair, the biggest issue we talk about is the retear rate. Retear rate in overseas studies in the order of 40% for a full thickness tear, and that's quite significant. You don't want to do this a second time, so what we want to do is eliminate that retear rate as much as possible and reduce it to the lowest amount. So that means being very careful with the post-op rehab and taking things slowly for the first 3 months. Normally 6 weeks in the sling full-time. If it's a very big tear, maybe a further 6 weeks part-time in the sling. And typically I will scan you at 6 and 12 weeks post-operatively with an MRI scan to ensure the rotator cuff is intact. Now, other complications, when you're thinking about this operation, there's a small risk of infection. That's 1 in several hundred. The biggest complication is probably that of frozen shoulder. Frozen shoulder will go away. It will actually help everything heal up and help you get a good result with your rotator cuff repair, but it can be miserable until it goes away with pain and stiffness. DVTs, hematomas, all of those sort of things can happen. Nerve injuries are exceedingly rare. 1 in several thousand will be the risk there. And you have an anesthetic. The anesthetic is a significant anesthetic. We do want to drop your blood pressure a little bit for the arthroscopic rotator cuff repair, and there's a risk from the anesthetic itself. Now let's put some science behind that. So there's 3 articles I'm going to bring to your attention. If you'd like to look at these scientific publications, if you scan that QR code, it will take you directly to the publication and you can review it yourself. Carr et al. In the Journal of Bone and Joint Surgery in 2017 published a multi-center randomized controlled trial of rotator cuff repair, and they found a retear rate of 40% in the patients having an arthroscopic rotator cuff repair or open rotator cuff repair. And it didn't seem to matter whether it was open or arthroscopic in terms of that. And then there were 2 systematic reviews, one in 2023 and the other in 2021, looking at this. So the UCUF trial, which is Carr et al. In 2017, they had a total of 273 patients. They had a retear rate of 46% overall, so a bit higher than 40%, which I mentioned before. The infection rate was 0.7%, which I think is a little high. Nevertheless, that is what they found. The 2023 systematic review looked at 76 studies, and they found a retear rate ranging between 9.3 and 24.5%. And they said they felt the retear rate was realistic at about 20%. Depending on whether it was a small tear or big tear, changes the retear rate. Reduced range of motion, so something like frozen shoulder, 99.2%, 4% rate of frozen shoulder. Infection in 0.5% to 0.8%. Nerve issues about 1%. That seems high to me. I assume that those are little issues that go away. They can have little patches of numbness and so on. Persisting pain, so these rotator cuff repairs can ache for a period of time afterwards. Normally that will go away after 12 months, but in this group they found a rate of patients having ongoing pain and discomfort and ache in the shoulder. For Felsch 2021, they looked at 1,661 cases with a retear rate of 3.2%. That was the lower end of things. There were ultrasounding patients at 6 months post-op. Reduced range of motion 7.6%. They didn't report a rate of frozen shoulder. infection was 0.7%, nerve issues 1.7%, and persisting aching pain 3.3%. So what I would say is rotator cuff surgery, the rehab for it, is probably the slowest and one of the most difficult of all the operations I do. The shoulder tends to ache. It does take quite a long time to complete the rehab. Rehab often will go between 6 to 12 months. It's not unusual for someone that has to do manual work, particularly if it's overhead, to take 12 months to make a full recovery from this surgery. Now, I hope that gives you a good rundown on the risks and potential complications of this operation and a better understanding of what's involved in an arthroscopic rotator cuff repair. Thank you for listening.